Today I will talk about dry needling. The needles stimulate the muscles which causes them to contract or twitch that help to relieve pain and improve range of motion. When dry needling is applied to your muscles and tissues, it can decrease tightness, increase blood flow and reduce local and referred pain. We use solid needles that don't contain any kind of medication. That is why the technique is called dry needling, because nothing is injected into your body. So let's talk about how does this work. When your muscle is overused, it goes to an energy crisis where the muscle fibers are not getting an adequate amount of blood supply. When they don't get the normal blood supply, they don't get the oxygen and nutrients that allow your muscles to go back to their resting normal position. Stimulating a trigger point with a needle helps draw normal blood supply back to flush out the area and release tension. The prick sensation can also fire off nerve fiber that stimulate your brain to release endorphin, your body's homemade pain medication. Usually, trigger points are painful to touch, so before the needling, you may experience some pain while your provider is locating the trigger point. Dry needling may help relieve pain and increase your range of motion. Conditions that dry needling may treat include joint issues, disc issues, tendonitis, migraine, and tension-type headaches, jaw and mouth problems such as TMJ, hip lash, and repetitive motion disorders such as carpal tunnel syndrome, spinal issues, pelvic pain, night cramps, and phantom limb pain. Thanks for your attention. I hope you like it and a better understanding of dry needling. If you have some problems and have trigger points or muscular tension, you can come to me. I will solve your problem. Thank you.